Let me ask you something, and I want you to answer honestly, even if it's only to yourself. In the past few days, have you found yourself in the bathroom, feeling the need to go, but despite waiting, nothing happened? Not because you weren't trying, but because your body simply would not respond. You could feel the pressure, you could feel the fullness, but when you tried, it was like pushing against a closed door. If you're nodding along right now, I want you to know two things before we go any further. First, you are not alone. What you're experiencing affects millions of adults over 60, and most of them never say a word about it to anyone, not even their doctor. Second, and this is the part that matters most, what you may be dealing with is not ordinary constipation. It's a different clinical situation, and trying to treat it like ordinary constipation can quietly make it worse. My name is Dr. Marcus Reeve, and approximately the next 20 minutes, I'm going to walk you through exactly what's happening inside your body, why this becomes more common after 60, the warning signs that mean you need attention soon, and a clear, practical plan you can act on starting today. A brief note before we begin. Everything I share in this video is general health education grounded in current medical understanding. It is not a substitute for personalized medical advice or an evaluation by your own doctor, who knows your history, your medications, and your specific situation. If your symptoms are severe or worsening, please do not delay. Consult your physician or seek urgent care. If this conversation feels meaningful to you, type yes in the comments. It helps this video reach others who are quietly going through the same thing. Now let's begin. To understand what's happening, I want you to picture your large intestine. It's a long, muscular tube, roughly 5 feet in length, that wraps through your abdomen and ends at the rectum. Its job is twofold. It moves waste forward through gentle, rhythmic contractions called peristalsis, and along the way, it pulls water out of that waste so your body stays hydrated. Under normal conditions, this is a quiet, automatic, beautifully coordinated process. You don't think about it. It just works. But here's where things shift, especially after the age of 60. Several changes start to happen, often gradually, often without anyone warning you in advance. The muscular contractions that move waste forward begin to slow down. The nerve signals that coordinate those contractions become less efficient. The stretch receptors in the rectum, the tiny sensors that tell your brain it's time to go, become less sensitive. Your sense of thirst quietly diminishes, so you drink less water without realizing it. And many of the medications most commonly prescribed to older adults, including certain blood pressure drugs, iron supplements, opioid pain relievers, some antidepressants, and antihistamines, have constipation listed as a known side effect. Put all of those factors together, and you have an internal environment where stool moves through the colon more slowly than it should. It sits in the lower segment too long, and gradually, over days, that stool transforms from something soft and manageable into something dense and firm. When that dense mass settles into the rectum and becomes too large or too firm to pass, doctors refer to it as a fecal impaction. This is the clinical term, but in plain language, it means the passage is obstructed, and typical remedies may not resolve it. This is the part most people miss. Adding more fiber on top of an already blocked outlet doesn't help. In fact, it can make the discomfort worse, because you're adding bulk above a passage that can't open. Stimulant laxatives that work higher up in the colon can't push past a hardened mass that's already at the exit. They just create painful cramping against a closed door. So if you've been trying these things and feeling like nothing is working, please hear me. It isn't because you're doing something wrong. It's because the tools you've been reaching for were never designed for this specific problem. I want to spend a few minutes here on the symptoms, because some of them are deeply misleading. And misreading them can lead people to take exactly the wrong action. The first sign, the one most people recognize, is a persistent feeling of rectal fullness that doesn't resolve. You feel like you need to go, you sit, nothing comes, and the feeling lingers for hours or even days. The second sign is the one that catches almost everyone off guard. It's termed overflow or paradoxical stool leakage. Here's what happens. When a firm mass blocks the rectal passage, liquid waste from higher up in the colon still keeps moving. With limited passage, it seeps around the edges of the obstruction and may leak out as watery discharge. People see this and naturally think, "I must have a stomach bug," or "this is diarrhea." And then, understandably, they reach for an anti-diarrheal medication. Please listen carefully here, because this is one of the most important things I'll say today. If you're experiencing what appears to be diarrhea alongside several days of feeling like you can't fully empty, do not take an anti-diarrheal medication without speaking to a doctor first. Anti-diarrheals slow intestinal movement. If there's an impaction behind that liquid, slowing things down makes it worse, not better. The third sign is lower abdominal discomfort, bloating, or a constant low-level pressure that doesn't ease up. The fourth sign is difficulty urinating. This one surprises many of my patients. The rectum and the bladder share a confined pelvic space, separated only by a thin wall of tissue. When the rectum is distended with a hardened mass, it physically presses against the bladder from behind. The result can be a sudden urgency to urinate, a feeling of needing to go constantly while only passing a little, or, in more serious cases, real difficulty emptying the bladder. I've had patients walk into clinic certain they had a urinary infection, when the real cause was a rectal impaction pressing on the bladder. Once we addressed the impaction, the urinary symptoms resolved on their own. The fifth sign is one I want every family member of an older adult to hear clearly. In older adults, a significant fecal impaction can sometimes be associated with confusion, agitation, or sudden shifts in mental clarity. This is an observed phenomenon in geriatric medicine. The combination of physical stress and discomfort can sometimes manifest in ways that resemble a cognitive episode. If an older loved one suddenly seems off without an obvious explanation, their bowel status is always worth considering as part of the picture. If any of these are familiar, take it seriously. Not panicked, but seriously. I want to give you a clear picture of when this stops being something you manage at home and becomes something that needs medical attention without delay. Most cases of fecal impaction can be addressed safely, but there are warning signs that mean the situation has escalated beyond home care. Please contact your doctor promptly or seek urgent evaluation if you experience any of the following: a hard, rigid, tender abdomen, a fever, severe abdominal pain that is constant and getting worse rather than coming in waves, persistent vomiting, complete inability to pass gas at all over many hours, or any sudden episode of confusion, weakness, or cold, clammy skin in an older adult. These are not symptoms to watch and wait on. These are the body's way of telling you the situation needs professional eyes on it now. I'm not telling you this to frighten you. I'm telling you because clarity is a form of care. When you know exactly when to call for help, you can stop second-guessing yourself, and that peace of mind is worth a great deal. Now let's talk about what you can actually do, starting from the gentlest, safest steps and working upward only as needed. Before I walk you through this, I want to be clear that for anyone with significant medical conditions, recent abdominal surgery, or concerning symptoms like the ones I just listed, please call your doctor before attempting anything at home. For everyone else, here's a measured approach. The first thing I want you to do is stop straining. I know how counterintuitive that feels. Your body is telling you to push harder, try a different angle, bear down with more force. But a hardened impaction does not respond to pressure the way normal stool does. It's too rigid to compress. What additional straining does is increase the risk of hemorrhoids, anal fissures, and in older adults with cardiovascular conditions, it can place real strain on the heart. So please, set that instinct aside for now. The next step, after speaking with your pharmacist or doctor, is to consider a glycerin suppository. Glycerin works gently by drawing moisture into the area and softening the outer layer of the impacted stool. Lie on your left side, which positions your anatomy in a way that works with gravity rather than against it. Use generous lubrication. Stay still for at least 30 to 45 minutes after insertion. This part matters more than people realize. Glycerin needs time at body temperature to do its job. If you rush to the toilet after 5 minutes, you've essentially wasted the attempt. If gentle methods at home don't produce results within a reasonable window, or if you're uncertain at any point, the right next step is to contact your doctor rather than escalate on your own. There are clinical interventions available, including medically administered enemas and, in some cases, a procedure called manual disimpaction, which sounds intimidating, but is a safe, routine treatment performed by a clinician. The relief patients describe afterward is, in their own words, immediate and profound. For everyone else, here's a measured approach. Before I walk you through this, I want to be clear that for anyone with significant medical conditions, recent abdominal surgery, or concerning symptoms like the ones I just listed, it is essential to contact your doctor before attempting any home remedies. Clearing the immediate problem is essential, but if we stop there, the same situation tends to return, often within weeks. So let's talk about the underlying factors, because this is where lasting change actually happens. The first thing I encourage every patient over 60 to do is have a thorough medication review with their doctor or pharmacist. Bring every prescription, every over-the-counter pill, every supplement, and lay them out. Ask directly, could any of these be contributing to my constipation? And are there alternatives we could consider? Many doctors don't bring this up unless you raise it. You have every right to raise it. The second factor worth exploring, especially if you've struggled with this for a long time, is something called pelvic floor dyssynergia. This is a condition where the muscles that should relax during a bowel movement instead contract or fail to coordinate properly. It's more common in older adults than most people realize, and it can be evaluated and treated by a specialist. The treatment, called biofeedback therapy, has strong evidence behind it. Published research in the field of gastroenterology has shown that biofeedback can significantly improve symptoms in patients with this specific form of difficulty. If your situation hasn't responded to standard approaches, ask your doctor whether this might apply to you. The third factor is one we often overlook. Many older adults, often without realizing it, have spent years suppressing the urge to defecate when it wasn't convenient. Over time, this can desensitize the very signals that initiate a bowel movement. The rectum becomes less responsive. The urge becomes less reliable. The good news is that this can be retrained gently and patiently over weeks.
Now let's talk about the daily habits that genuinely protect your digestive health for the years ahead. None of these are dramatic. None of them require expensive products. They simply require consistency. Hydration comes first. Water is the single most powerful tool your colon has for keeping waste soft. The challenge after 60 is that the natural thirst signal becomes less reliable, so you can be quietly underhydrated without ever feeling thirsty. Aim for steady, deliberate fluid intake throughout the day. 6 to 8 glasses is a reasonable general target for most adults, though your doctor may adjust this based on your heart, kidney, or other health considerations. Warm herbal teas, broth-based soups, and water-rich fruits and vegetables all count. Movement matters more than people give it credit for. Your intestine is not a passive tube. It responds to physical activity. A gentle 20 to 30-minute walk after meals stimulates what's called the gastrocolic reflex, a natural wave of intestinal motion that helps move waste forward. If walking is difficult, even gentle stretching, chair exercises, or simply standing and shifting position regularly throughout the day makes a real difference. Prolonged sitting is one of the most underappreciated contributors to slow digestion in older adults. Fiber matters, but with one important caveat. Soluble fiber, the kind found in oats, ripe fruits, cooked vegetables, and legumes, helps stool retain moisture and pass more easily. Insoluble fiber, like wheat bran, can be helpful for some people, but can worsen discomfort for others, especially if hydration isn't adequate. Introduce fiber gradually and pair it with plenty of fluids. Posture matters more than you'd expect. The human body wasn't designed to eliminate from a fully seated position. Placing a small step stool under your feet when you sit on the toilet, raising your knees slightly above hip level, brings your body into a more natural angle and meaningfully reduces the effort required. It sounds almost too simple to make a difference, but for many people, this single change brings real relief. And finally, listen to your body's signals. When the urge arrives, respond to it. Chronic suppression, even with good reason in the moment, gradually retrains your system to ignore those signals over time. If you can build a consistent morning routine, sitting on the toilet at the same time each day, ideally within 30 to 60 minutes of breakfast, when the gastrocolic reflex is strongest, you give your body the rhythm it's looking for. Before I close, I want to speak directly to a group of viewers who may be watching this not for themselves, but for someone they love. A parent, a spouse, a sibling, a patient. If you're caring for an older adult who has limited mobility or who has trouble communicating their discomfort clearly, please know that fecal impaction is one of the most common and most under-recognized issues in this population. The signs may be subtle: unusual restlessness, a change in appetite, confusion that seems to come from nowhere, a few days of no clear bowel movement, liquid leakage that's mistaken for diarrhea. Don't be embarrassed to bring it up with their doctor. This is a clinical reality that affects a meaningful percentage of older adults, and addressing it early prevents far more serious complications later. A simple conversation, and sometimes a simple abdominal X-ray, can clarify the situation quickly. Your attention and your willingness to ask uncomfortable questions on their behalf
is one of the most loving things you can do.
Let me leave you with this. The conversations that matter most in medicine are often the ones that feel the most uncomfortable to have. Discussion of bowel health, particularly in older adults, has often been sidelined in polite conversation for too long. The impact of this silence has been significant, with individuals experiencing prolonged discomfort that could have been addressed with clear and compassionate medical guidance. You deserve to understand what's happening inside your own body. You deserve a clear plan when something goes wrong. And you deserve to know that whatever you're going through, you don't have to figure it out alone. And you certainly don't have to feel ashamed of it. If today's video was useful to you, please share it with someone in your life who might quietly be struggling with this. They may not have the words to ask for this information, but they need it. And if you'd like more honest, science-based health education for older adults, you're always welcome to subscribe to the channel. One last reminder before I close the video. Everything I tried to explain today is for educational purposes and reflects general medical knowledge, not personalized advice for your individual situation. Your body, your medications, and your medical history are unique to you, and only your own doctor can evaluate them properly. If anything in this video raised concerns about your health, please bring those concerns to a qualified healthcare professional. Take care of yourself. Drink your water. Move your body when you can. And please, talk to your doctor. See you in the next video.